Assalamualaikum, my name is Nadia. This is assignment 3 for Psychology and Sociology for nurses. The assignment 3 is based from the assignment 1 with the requirement question. Discuss how biological factors, for example, the brain function, genetics, hormone, that can influence the human behavior. The second one is a relate this influence on nursing practice by providing example on how nurses can integrate psychological and sociological perspective when managing patients with the behavioral or mental health issue. So the third requirement is to use a critical thinking strategies to analyze the scenario and propose evidence-based intervention. Now, so as an introduction, human behavior is influenced by biological, psychological, and sociological factors. As a nurse, you must now understand how brain functions, genetic, and hormones affect behavior to provide the holistic care. And this presentation also explores the biological influence and nursing strategy for mental health care. So we start with the biological factors. Biological factors are physical, internal characteristics of the body. These are 4 factors that can influence human behaviors, like behave, things, and feel. First, brain functions. We have to know the neurotransmitters, hormones, and also genetics. Okay, this is a diagram of the brain labeled with the structure. We have a 4 structure, prefrontal cortex, amygdala, hippocampus, and cerebellum. For the prefrontal cortex is a part of frontal lobe which is located at the very front of the brain. This part is responsible for decision, making impulse, control personality, and emotional regulations. So we have the amygdala, located deep inside the brain, located in the temporal lobe. It is responsible for emotional processing, for example, fears, angers, and aggression. When someone in danger, this part triggers the body to release the adrenaline and cortisol hormone. But what happens if amygdala is overactive or damaged? Someone will experience with the anxiety, phobia, heightened fear. When amygdala is damaged, it will affect someone like poor recognition of danger, lack of emotional response. So we have the hippocampus. This is part located in the medial temporal lobe near to amygdala. The main function of the hippocampus are memory formation, learning, emotion memory. It's work with the amygdala to link emotions with the memories. For example, they are remembering traumatic or happy events. And then lastly, we have the cerebellum. As we know, cerebellum is a little brain that located at the back of the brain, below of the occipital lobe and behind the brainstem. The main function of cerebellum such as a motor coordination, like a walking, writing, and speaking. And then the second one is a maintain a physical balance, a body posture. If the cerebellum is damaged, someone will experience with the tremors, the dysmetria, slurred speech, and ataxia gets imbalanced. Okay, now we will go the second biological factor, that is a neurotransmitter. Neurotransmitter is a chemical messenger that transmits signal between the nerve cell. So, for example, we have the serotonin, dopamine, and norepinephrine. So, serotonin is mood stability, but if the level is low, it can lead to depressions. With the dopamine, for example, with the dopamine, is like a motivation, but if too much, it will lead someone to have the schizophrenia. So we as a nurse, we should observe the hormone related to mood or behavioral changes also. Okay, now we will go to the third biological factor, is hormonal. So for example, we have the cortisol, testosterone, and also the estrogen. For the cortisol, this is the stress hormone. But if this hormone is high level, it will lead to someone to get the anxiety. And if it is with the low level, it will lead to someone to have the fatigue and also depression. Some goes with the hormone, estrogen and progesterone. Its affect mood, especially in female. Okay, genetic is the last point for the biological factors that can influence or on someone behaviors. Genes a segment of DNA passed from the parents to the children that act like the instruction for how the body and the brain develop and functions. While the environment also plays a role, like the genetic factors have a strong influence on behavior and mental process. So, personality refers to the consistent patterns of thoughts, feelings, and behavior a person displays. So, genetic influence, this is according to the researcher. For example, someone with extroversion, it's actually related to the higher dopamine activity, which increase the brain rewards sensitivity. So someone with the introversions, it may be associated with the lower stimulation needs and difference in brain arousal system. So as nurses, we should consider family history in our assessment. And also we should understand the personality types so that can help us to communicate and build trust with the patient. For example, the introvert patient, they may need the more space and also time. Okay, now we will go to the schizophrenia disease. So the symptom is like including the hallucinations that sometimes patient can seeing or they can hearing things. Paranoia, that is the extreme mistrust, and cognitive deficit, that is the poor memory, poor attention or reasoning. So this is caused by link to the dopamine imbalance and genetic predisposition and brain structure abnormalities. We as a nurse should create a strategies to handling patient with the schizo for example, reality orientation. So we can gently guide the patient back to the reality without the confrontation. For example, if the patient said, I heard a voice telling me that I'm being watched. So as a nurse, we can tell the patient that, okay, I understand that they're very real to you, but I don't hear any voices. You are safe with me. So this, we can keep a calm to communication, speak in a soothing and non-judgmental tone so that we can reduce the distress. We can provide the environments such as consistent daily routine, such as a breakfast 8 o'clock and medication at 9 o'clock, and we can create a group activity start at the 10 o'clock. So this one can help the patient to feel safe by knowing what to expect. So we should also give a clear and simple instruction. For example, first, we'll check the blood pressure, then it will help you get ready for lunch. So this one, the simple things can avoid the confusion, and also we can reduce the patient's anxiety. And also we can create a small action that can help patient feels more secure and emotionally stable, which is especially important in mental health setting. So now we'll go to the managing the hallucination. For example, the validate experience. So we have to acknowledge the patient's feeling without the confirming the hallucination. For example, okay, I understand that it's real for you. And also, we should avoid the confrontation. It's mean that do not argue or deny what they are see or hear. This can increase the distress and aggression. And also, we can assess the content. For example, the patient is like a self-harm or violence. And also, we can ensure the safety, for example, monitor the patient closely, use calm communication, and involve the mental health team if there is any risk. Okay, as we are nurse, we can distract the patient with this schizophrenia that are facing with a hallucination. For example, encouraging them to listening a music, reading, journaling, making a art, making a social interaction between them, and also the grounding the techniques. For example, we bring our patient walk and listening to music together. Okay, this is a requirement from the question that how we use the critical thinking's strategy to analyze scenario and propose the evidence-based intervention. Okay, this is the scenario that I give an example that is paranoia. But what is a paranoia? Paranoia is when a person feels extreme fears, mistrust, or suspicions, even when there is no real danger. But why it is happen? It's often linked to overactivity in the amygdala. This one, especially in a patient with a psychotic disorder like the schizophrenia. And the common symptom is like a refusing food, medication, or care. Sometimes they're avoiding people or staying isolated, and also they believe others are spying or trying to harm them. So, what is our nursing approach to them? As a nurse, we can use a calm, consistent routine to reduce the confusion and fear. We should avoid the argument about their belief, validate the feelings, not delusions. We should speak gently to give clear explanation and earn trust over the time. For example, we can tell them, okay, I understand you feel unsafe right now, but you are a safe place and I'm here to support you. Okay, as a nurse, we should have the critical thinking that approach this happen. For example, assess the situation. What is the patient saying or doing? Sometimes this patient, we should check them. Either they are expressing a fear or mistrust. For example, they will say that someone is watching me, and then are the patient is refusing food or medicine or the care, and also are the patient is avoiding people or showing sign of the withdrawal. So we will go to the sign of distress and aggression. We can check the patient is look anxious, angry, or scared, or are the patient is pacing, shouting, or acting defensively, or the patient is making threats or acting like they might harm themselves or others. So this step helps us to understand that what's going on and how serious the situation is, and so that we can plan the right response to keep the patient safe and also calm. So this one also we can understanding the root cause that can help us as a nurse respond with the compassion instead of frustration and plan the right of care. So the first thing we should understand the underlying, of course. The first one is like recognize the paranoia. Paranoia may be linked to the psychotic disorder or excess activity amygdala. If it's too much activate, the person may feel afraid even when there are no real danger. Sometimes patients also the post-trauma like the abuse or violence that making the person feel unsafe or unable to trust the people. Okay, as a nurse, you can plan an appropriate response. For example, choose a non-threatening approach so that it will help the patient feel safe and also can reduce the fear. For example, you can speak calmly, use gentle body language, and give the patient a space. And the second one is avoiding challenging in the illusion directly. And we should don't say we should not say that that's not true or argue with the patient, because it can make the patient more upset and uncooperative. And also focus on validating the emotions, not belief. It's mean that we showing empathy without arguing with the delusion. Maybe we can say that I can see this is real. This is really upsetting for you. We try not to validate their emotions so that they can have their trust to us as a nurse. Okay, for this slide, this is the evidence that based on intervention that we apply for our patient. The first one is use calm and consistent communications. So we should speak softly and clearly so that we can avoid the sudden changes in tone or body language to prevent increasing the patient's suspicions. And also we should provide a structured environment, such as environment with the reduced noise and also the lighting, because a quiet and the calm space can help the patient feel relaxed. And then with the lighting, the bright lights and loud sound can make anxious and paranoid to the patient, and the patient will feel the overwhelmed. We should also build trust gradually. It's mean that let the patient choose us, for example, is sitting, keep a routine predictable, and also they explain procedure clearly. As a nurse, we should always tell the patient that you are going to do before doing it. Can reduce the fears and build the confidence in our care to the patients. And the next point is avoiding arguments, because we don't want to try to convenience with the patient that their belief is a false, and also arguing that can make them feel attacked and more defensive. So we should monitor also for the safety. If paranoia leads to aggression or self-harm raise, involve the mental health team, and also increase the observation. Okay, as a conclusion, biological factors like the brain function, genetics, and hormones have a strong impact on human behavior. To give the best care, nurses should also consider psychological and social factors that affect each patient's experience. By using the critical thinking and evidence-based strategies, nurses can provide safe, effective, and compassionate care, especially for those with the mental or behavioral health needs. Thank you.